I'm John Morris. I've been a palliative care doctor now for 20 years. We started a palliative care program in Western North Carolina, and I've worked in both hospitals and communities. I worked with Janet as a consultant for many different palliative care programs around the country and really enjoyed teaching palliative care to new providers, doctors, nurse practitioners, and PAs that are interested in learning this because it's a great field. And we have the opportunity to care for people in the most vulnerable times and really do good work that is very gratifying. It's been a pleasure for me to teach.
Hi, I'm Janet Bull. I'm a hospice and palliative care physician for the last 25 years. I started my career as an obstetrician gynecologist, so I've actually gone from the beginning of life to the end of life. John Morris and I started teaching the Palliative Care Immersion Course in 2010 because we saw there was such a lack of knowledge with new providers who were coming to work for Four Seasons. So we decided to open up the course nationally, and we've been able to train over 1,000 nurse practitioners, physicians, physician assistants, nurses, and social workers in our course. I think what's unique about the immersion course is that it puts people in small groups to really work on skills, good communication skills, goals of care planning. How do you deal with dysfunctional families or families that are really struggling to accept a diagnosis? So there's a lot of small group attention given to the individual.
This is a really creative teaching model. We use small groups like Janet says, but we use role plays where we practice conversation skills. We do a lot of case-based interactive learning where people solve problems in small groups and it's very interactive. Even though it's virtual, you're in front of a screen, it's really interactive so that you're always working with coworkers and you're solving palliative care problems. It's cases, we even have some drama. We have demonstrated case scenarios. It's quite creative.
The other thing we do is we do some didactics that people really want to learn about. How do you get better at prognosticating? How do you get better at symptom management in patients who have severe pain? We really dig into some of the diseases that we see end stage heart disease, end stage pulmonary disease, and liver disease, and really talk about some of the key features for taking care of very complex patients.
Yeah, what are the unique challenges to patients with COPD or heart failure? And how, as palliative care providers, we provide them the best care so that they live the best quality of life. Our course talks about conversation skills, it talks about pain and symptom management, adjuvants, and then the unique challenges that we face in each individual with serious illness. Anyone interested in improving their skills in palliative care should come to our palliative care immersion course. The course was originally designed for nurse practitioners, doctors, and physician assistants that have been practicing in internal medicine or primary care or specialty care and want to start a new career in palliative care. And the course will give them all the skills they really need to get started on that first day of work. The course is originally intended to be an overview and introduction to these key skills for providers that are skilled in medicine but need to learn how to do palliative care consultations. But what we've learned is that people with years of experience have really benefited and loved the course. We had a professor from Duke that had been a palliative care teacher for 10 years, and she said it was one of the best courses she's ever taken in palliative care. We found that it's helpful not only for new palliative care providers, but also for people with years of experience that want to improve their skills.
It's so interesting that the people who are experienced and inexperienced get together in groups and they really help one another. They learn from one another in these groups. So we strategically don't put all the newbies together. We mix them up. So we strategically look at the small groups and how we set them up. Each one of the small groups has a facilitator, either one of our staff members or somebody who's pretty well known around the country in good communication skills and helping the small groups tackle some of these skills-based trainings that we do. The value proposition is when someone finishes this course, they feel so much more equipped to handle the complex patients that they're taking care of. And throughout the years, John and I at these annual conferences will meet people who took our course 3, 4, 5 years ago, and they come up to us and they talk about what they learned in the course and how it really benefited them in their everyday work environment. In addition, we also talk about the importance of self-care and talk about some strategies that people can have both individually and in their group practice for how to promote balance in their lives, because it's really tough work that we do. So we also want to make sure we're taking care of the providers who are doing the work.
The other thing that leaders of programs have told me that they send all of their providers to our course because with our course, these providers learn the skills that's necessary to really succeed. If a hospice organization is going to start a palliative care program, they often send all their providers because they know that by the end of that week, they'll have a good framework on how to take good care of patients and how to prognosticate and when's appropriate to refer to hospice. Hospital programs send us all their palliative care team because they know that once they go through our course, they'll be able to provide good care for these hospitalized patients. A number of programs send each person at least once to our course so that everyone has a good framework and understanding of what's needed in caring for these seriously ill patients.
They get 40 hours for a physician of CME credit. We do meet the pharmacy credits as well. You get the bulk of the CME requirements in one course.
We provide 40 hours of CME or continuing education credit for any physician, nurse practitioner, nurse, social worker that attends our course. We offer this course 3 times a year virtually. We almost always offered it sometime in the spring, in the summer, and the fall. It's a great opportunity to sign up with your teammates or sign up and join us as a team. We offer it 3 times a year every year.
It's like a boot camp. It's a 40-hour commitment. And initially, John and I taught this course in person in Asheville. And then when COVID hit, we realized we needed to go virtual. That allowed us to do a couple of things. It allowed us to get great speakers like Lynn McPherson, who's well known on teaching pharmacy issues. He's a pharmacist. We've been able to bring in well known people in their field. It also allows people to stay at home, which is a benefit often when they're raising kids or have other commitments. But initially, I thought nobody's going to be able to stay on the screens for 40 hours. That's tough. But what we find is the class is so engaging that people do stay on the screens for 40 hours. Yes, they're tired at the end of the week, but they don't want to miss anything. And we really want them to be there for every piece of content because we make sure it's going to be value added and value packed. There are nurses who are leaders of palliative care programs. There are social workers who may be leaders of palliative care programs. Or, as John said, there are teams, whole teams that come. Often a palliative care team has a provider, a nurse practitioner or physician. They may have a nurse on their team and they may have a social worker. And occasionally they may have a chaplain. So we've had every discipline take the course and all have benefited from it.
Most of the people are organizations that send us these people. They're either a hospice organization or a hospital system that wants to train their providers. We have a huge resource library that we give to participants in our course, and this includes all of the lecture materials plus lots of different resources, articles that have been written about the subjects, pain and symptom management resources. So people get a huge booklet of information, almost 1,000 pages of resource material that they can refer to at other times.
And we also want to make sure that they have a network. So John and I give out our personal emails. We want them to know we're here for them. They often form Facebook groups. We form Facebook groups for different classes. We even had one class probably 7 or 8 years ago where a couple met each other from different states and they ended up getting married. John and I got an invitation to their wedding last year. Anything can happen at the immersion course.
Janet and I just love to keep up with people and see how their careers go. And Janet and I stay involved with our participants. Just had an email from a physician on the West Coast last week who had some questions about palliative care. She took her course 5 years ago, but she was emailing me this past week with questions. We'd love to hear from our previous graduates and we'd love to hear how they're doing. And it's been really rewarding for us to see them succeed in this field and take such good care of patients and make the world a better place. The future of healthcare is much more about personalized care and much more about care in the home, much more about values. These palliative care skills are going to be really important for the future of healthcare, whether somebody actually works as a palliative care consultant or whether they work in primary care or specialty care, because these skills are the future of healthcare. How do we have good conversations with people? How do we ensure that they get the care and support that they want? Healthcare is amazingly complicated these days, and people have so many different options, and they need good advice on how to navigate the really complicated healthcare system. Whether the providers are primary care providers or specialty providers, they need to know how to care and guide their patients through the complexities of serious illness. These skills are going to be tremendously valuable going.
As John said, the need and the growth of palliative care is really coming of age. It started in the hospitals and then it started to slowly move into the communities. And what that means is there's a great demand for palliative care providers. Some of these providers that we're now seeing in our class are very different than in 2010. We tended to get more experienced providers back then. Now you may have a new grad out of an NP program or a PA school who has been hired to build a program or start a program. So there's this great demand for providers. There's not enough providers to go around, and they don't often have the skill sets they need from their school training. What we try to do is bundle up the most important skills that we think will help carry them forward and put it into a week boot camp. That's what they get when they take our course.
Palliative care really is a tremendous growth industry. They're estimated that there are 20,000 more opportunities than there are providers to fill them. It's a great field to get into. There's always going to be needs. And right now, most of the larger hospitals have started palliative care programs, but community-based palliative care is just starting. The skills that we teach in the palliative care immersion course help providers in the hospital, but also help new providers grow community-based palliative care to serve people that are seriously ill in the community.
With the baby boomers now really reaching the peak, baby boomers like John and I, you can just see the need growing exponentially. That's why we've got to get as many trained providers out there who can do a good job and take care of this growing population entering the 70s and 80s, their lifespan. I would tell you that this course is fun. We love to teach. We love what we do. We learn from one another. If you're considering honing your skills, getting a bigger toolbox so that you can do a better job taking care of your patients and families, this course is for you.